Pat Maguire has spoken out after he and his family chose to find residential care in Beverley in East Yorkshire for his father-in-law who had dementia. But because of issues surrounding closures and suitability, his father-in-law had to be moved 4 times after initially settling into his first care home.
While we can't ever prove it, we honestly believe that the moves that he had to undergo affected him and made his condition worse. Yes, they give money to local authorities, but it's the government through taxation that ought to be caring, just as we expect them to do for small children, the young. We ought to be providing the same level of care from government for the elderly.
Others believe that the way money is distributed within the care sector is vital in ensuring that the right services are delivered.
Even when the country was better off economically, social care was left at the bottom of the list, so it never got the funding when we could afford it. Now we can't, it's a problem. But the NHS, struggling as it is at the minute, has had a better share of funding, spent a bit more on social care, relieves the pressure on the NHS, so about moving some money from them to us. But my personal view is it's about time the NHS and social care were in one body.
Funding issues have been blamed for a number of care homes which have had to close down. And early this month, Jeremy Corbyn said a Labour government would take failing private care homes into public ownership in order to maintain social care protection. But the Conservative MP for Beverley and Holderness says that isn't the answer.
What we don't want to do is what the Labour Party want to do things like nationalising a failing home with high costs, low numbers of residents and no way of making it affordable. You know, the government's absolutely committed to getting this right. We look on the ground in Beverley, despite the current problems, in the next few weeks we're going to see new places coming forward, and over the next years I expect to see a much improved situation, and the government is playing its part in doing that.
In a statement, the Department of Health says that it recognises the pressures of an ageing population, which is why it announced nearly £900 million of additional funding for adult social care over the next 2 years. It adds that the Prime Minister has made clear that this is not just about money and that they're working to find a long-term solution which helps councils learn from each other to raise standards. But back in Beverley, Pat Maguire is not convinced.
I can only believe that it's going to get worse. Here in Beverley, we've lost or are about to lose over 30% of the beds that dementia patients could be going into in care homes. There are new homes being built in Beverley, but they're extremely expensive, and I suspect they will not want to see people that need far greater care than many people that just are frail.
Yeah, this is something I'm sure many people watching today will be able to relate to. We have a rising elderly population, but fewer care home places. What's the solution?
Well, I was interested in the package that £900 million has been found to help social care in the next 2 years. But of course, the local government associations say the actual shortfall is going to be £2.6 billion. And I think actually that what Mr Maguire was saying about a radical solution to this needs to be looked at. So after the Second World War, when we knew that healthcare needed a national approach, we set up the National Health Service. And I think now the time has come for all the parties to get together and think about a national care service funded out of general taxation. And I do think as well we need to integrate the National Health Service and whatever social care we have to make it actually work for people. But this is going to get worse, I think, and that's why action is actually needed now.
Well, Marty Vickers, you heard there an elderly man with dementia who in the last year of his life was in 5 different care homes. Now, when you hear stories like that, can you understand why many people say the care sector is in crisis?
Well, of course, because people judge the care sector or the health service more generally by their own experience. And politicians can come on TV and say, oh, we're putting the extra resources in, so many billion. But in actual fact, judgment is made, such as in Mr Maguire's case, by personal experience. I don't think, as Graham Stewart was saying on the package, the solution is in effect nationalisation, because local authorities have a duty to find a place for someone if a care home closes anyway.
Well, let me put that point to you, Diana Johnson. Jeremy Corbyn says he wants to take failing care homes into public ownership, effectively nationalising the care industry. Is that really possible?
I think we need to really think about how we do that. He's talked specifically about failing care homes. I want to think about how we provide the kind of level of social care across the country that people rightly should expect.
You don't agree with Jeremy Corbyn?
Well, that's one bit, but I don't think that actually solves the fundamental problem, which is about providing good social care all around the country. And I just wanted to say about local authorities, of course, my own local authority will have taken £40 million out of adult social care from 2010 to 2020 because of government cuts. So to put it all onto local authorities is wrong, and that's why I think national government needs to step up to the plate here and say, as a country, we need to think how we provide this for our elderly population.
Yeah, at the heart of this debate, Martin Vickers, is the fact that many councils say they just simply do not have enough money to deliver social care, do they?
Well, I'm on record in the House of Commons of having said that I think cuts to council budgets have reached a tipping point now. But in fairness, as Theresa May has said, it's not just a matter of putting the resources in, it's ensuring that councils and care home operators actually use those resources to their best. And there are many cases where that is not the case, but I do agree that there's got to be a solution. Whether you could find a cross-party solution, as Diana was mentioning, in all honesty, I rather doubt. Are the Labour Party, for example, going to give up on attacking the present government on the NHS because they've reached some agreement? I rather doubt that.
Well, part of the problem with the NHS at the moment is social care, and the fact that, as I think you said in your introduction about bed blocking, there aren't places for people to move on to after they've been part of in the NHS. So I think, if we can get some agreement around social care, that will help in terms of the NHS and the budget and problems that the NHS has got at the moment.
But people are being asked to pay more this year, 3% on their council tax bills. I mean, are you saying they should pay even more than that?
Well, in Hull, 3%, for asking for that 3% from people who are just about managing, is a lot to ask. That's why I think nationally the government needs to consider the fact that in Surrey they can ask their council tax payers to pay a lot more, but they've got a bigger council tax base. They will get more money from the council tax there than we get in Hull. So poorer areas like Hull will never be able to provide that level of service that we want to see for our elderly and disabled population.
Do you accept that, Martin Vickers, that poorer areas, and you represent an area that isn't swimming in money, those council tax rises are nowhere near going to be able to cover the extra costs of social care?
No. I mean, it is sort of, to some extent, putting a plaster on a gaping wound when much more serious surgery is perhaps needed. And it is perhaps a stopgap measure. I recognise the fact that the care sector, and we all know about ageing populations and so on, the reasons for this, but people do expect higher standards now. Changes in society mean that the elderly no longer stay with their families or their extended families during their dying years. So it is a major issue, and it's the biggest issue, I think, certainly in cost terms, that governments over the next decade or two are going to have to face.
Yeah, and it's a subject, of course, we shall come back to, but we'll have to get some more of the week's political news now. Here's Richard Edwards with